In the time we tell this next story, one woman will have died from heart disease. As we enter American Heart Health Month, a Plano nurse speaking out about her experience with heart disease, hoping to help other women. It's today's Ones for Wellness.
At that point,
Anniversaries are about a walk down memory lane.
so I came here.
And sometimes
Mimi came in to check on me.
they're life lessons that need to be shared.
Vomiting uncontrollably.
Carolyn Peabody never thought she'd be here in this room 1 year ago.
And I just remember sweat was just pouring off of me.
The Texas Health Resources nurse was having a heart attack.
In my mind, I didn't believe it till it was showing on an EKG.
As luck would have it, she was already in the hospital. Her co-workers, all nurses, sprung into action.
No true chest pain, no arm pain, but soaking through clothes, multiple layers.
We knew enough to know that she needed to get to the emergency department.
I know the signs and symptoms of a heart attack, especially in women, could be different than men. I did not think that was happening to me.
Dr. Ahmad Zankar took the case that afternoon.
And she had presented initially with these non-specific symptoms.
Researchers found 42% of women didn't have chest pain when they were admitted to the hospital with heart attacks. And Dr. Zankar says men and women present different symptoms.
There are symptoms that are more prevalent in women. Shortness of breath, nausea and indigestion, jaw or back pain.
And sometimes flu-like symptoms.
Carolyn.
You're my buddy.
For Carolyn, this anniversary matters. The lessons learned from this day will always be a part of her story, a story that could save the lives of others.
Women just need to listen to their bodies, understand that something may be going on that's not normal for them, and not try to make sense of it, but seek medical attention.
Such an important topic we need to talk about. Joining me now to go a little bit deeper, I have Dr. Nina Asrani, a cardiologist at Texas Health Harris Methodist Hospital in Fort Worth. And Dr. Asrani, as we were just mentioning, sometimes heart attack symptoms present differently in men and women. And we know about the classic chest pain, but there are other symptoms women in particular should be watching out for.
Absolutely. So the most common symptom both for men and women is that chest pain, we call it, but really more often a chest pressure. But especially for women, a lot of other symptoms, including pain that goes up into the neck or the jaw, an ache between the shoulder blades, pain that comes down the arms, especially into the left arm, but even more non-specific things. So just feeling suddenly very short of breath, very clammy and sweaty, really severe fatigue or weakness, and that feeling of nausea. Any of those things can be markers of heart disease in women.
And especially mothers out there, you tend to put your health on the back burner. Sometimes you don't feel good. You tend not to listen to your body. How important is it for you to be aware when something is wrong like that? And also to what level, what's the degree of symptoms that you really ought to be concerned that this is not your normal fatigue or your normal back pain?
So that's the hard part about a lot of these things, is that when we talk about some of these symptoms, people may say, well, I have that, but it's not that bad. And so it is really important to just try to be attuned to how you're feeling and what your body is trying to tell you. If something doesn't feel right, it's important to at least see your doctor so that that can be looked into further.
And let's talk about some of the things that we can all do to make ourselves a little bit healthier and to reduce the risk of heart disease in both men and women.
Absolutely. So the American Heart Association estimates that 80% of heart disease is preventable. And it's really basic things. So the fundamental things of diet and exercise, so trying to eat those fruits and vegetables, lean meats, healthy fats, whole grains, and then trying to avoid the sugar, saturated fat, red meat, trying to get exercise, and the recommendation is for 150 minutes of moderate aerobic exercise every week, and then knowing what your blood pressure is, your blood sugar, if you have diabetes, your cholesterol, and working with your doctor to make sure that those things are controlled.
Great information there. And what stands out to me? 80% of it is preventable, and heart disease is the #1 killer of both men and women.
Absolutely.
Dr. Asrani, thank you so much. Great information there. All right, Jeff and Kim, we'll toss it over to you.